Thank you, Zora. Being pregnant or taking care of a new baby during COVID-19 could bring all sorts of anxious emotions, and you are not alone.
Definitely. And joining us now to discuss the importance of practicing self-care and also getting support when you're pregnant is Senior Director of Clinical Capabilities at UnitedHealthcare Community and State, Carolyn Brooks. Carolyn, thank you so much for joining us this early in the morning. We really appreciate it.
Thanks for having me.
Of course. So let's just get right into it. We're curious to know how COVID has impacted the experience for new and also expectant parents.
Yeah, so while pregnancy can be a really exciting time for some families, it can also be a time of great stress and anxiety. And unfortunately, COVID has not made this easier. We're seeing an increase in the number of women who are reporting depression and anxiety as it relates to COVID, as they're concerned both about their own health, but that of their children. But even with COVID, we can't stress enough the importance to make and keep those prenatal care and postpartum visits. They're really critical to ensuring we are able to improve health outcomes for both mom and baby.
So in the midst of COVID, the importance of early prenatal and postpartum care you mentioned, what does that mean? How can people do that better?
Yeah, so as soon as someone thinks or learns that they're pregnant, it's important that they call and get an appointment with their healthcare provider. At that first appointment, they're going to be able to confirm the pregnancy and also get one started on a healthy pregnancy plan. And this is a great time to bring all the many questions that people may have to those visits. And the postpartum visit after birth, that's also critically important, as it gives the provider an opportunity to check to see if moms are recovering properly physically, but also have the emotional support that they need. And those are typically recommended within around 3 weeks after birth, with ongoing care as needed and a more comprehensive follow-up no later than 12 months or 12 weeks after the delivery. So really encourage people to connect with their providers and get connected to those visits.
This kind of goes hand in hand with what you just said, but do you have any more advice or any tips on that could help new parents or people who are pregnant?
Yeah, there are a variety of resources and programs that are available to support moms both early in pregnancy throughout the baby's first year of life, but many people aren't familiar with those, from getting connected to healthy free diapers, healthy food options, prenatal vitamins, car seats, breastfeeding supplies, and much more. So ask your healthcare provider and your health insurance provider what resources or programs they may have available to you. And our website, everypregnancy.com, gives you a little bit more information on some of those tips and tricks and resources that are available to moms.
That website again, everypregnancy.com, is that right?
Correct, everypregnancy.com.
And other websites, I mean, there's a lot of stuff if you Google this. What do you need to be careful about?
Yeah, so CDC, I know there's a lot of questions about things happening with COVID. So CDC is keeping up to date on information and guidance for moms who are thinking about becoming pregnant, as well as those who are pregnant. So again, that's a great resource, along with, again, everypregnancy.com. Again, we always encourage you to check with your healthcare provider and your health insurance provider, as they may have a number of programs and resources to be able to support you depending on your respective need throughout, both in that pregnancy journey, but also as you're becoming a new mom and trying to support and make sure you have all that you need to support a healthy baby.
All right, thank you so much for all that information. Carolyn Brooks joining us this morning, Senior Director of Clinical Capabilities at UnitedHealthcare Community and State. We appreciate all your advice and all of the information you provided this morning.
Yeah, thanks, Carolyn.